I'm Stephen Nimer, and I'm the director of the University of Miami Sylvester Comprehensive Cancer Center. I'm frequently asked, how do you distinguish myelodysplastic syndromes from acute leukemia, AML? AML is a disease characterized by an increased number of blasts in the bone marrow, more than 20%, often circulating blasts, cytopenias, some specific chromosome abnormalities, and a proliferative phase. A diagnosis of AML leads to treatment in all the patients, and generally the treatment is pretty urgent. Myelodysplastic syndromes are diseases that are characterized as bone marrow failure syndromes, but also the patient may have increased blasts. And so between 10 and 20% blasts, which is called refractory anemia with excess blasts, is a myelodysplastic syndrome, should behave differently than AML. It should not be as proliferative, and over time, the disease should be stable. There are certain criteria when, if present, an 821 translocation, the hour odds, that lead to the diagnosis of AML. But rather than focusing on definitions, it's important to follow the patient, determine what the problems are. Certainly in the old days we would treat some MDS like AML, and there's still some overlap in the treatments. Nonetheless, based on cytogenetics, blast percent, and the proliferative nature of AML, we usually can distinguish these two situations.